In this segment, we will look at the key differences and similarities between palliative and hospice care in regards to each goal, location, timing of initiation, payment process, and main eligibility requirements. The first point is the goal. Palliative care's goal is to help seriously ill patients feel better during their recovery, regardless of how long that process may be. Hospice care focuses more on easing the pain from dying for terminally ill patients, where recovery is a probable impossibility. Next, we will look at the location for each type of care. Palliative care most often occurs in a long-term or acute care facility or institution. In special situations, some patients can receive this care at home through a facility or agency. Hospice care almost always is given in a person's home, because of course their emotional and physical comfort now have become the priority. Now, in regards to timing, palliative care can be assigned to a patient at any time, from the time of diagnosis to the time of end of life. There are no restrictions for when this care can stop or start. Hospice care, on the other hand, almost always begins after all other treatments have stopped, because our focus is now on our patient's comfort. This is usually administered to patients when they are expected to live no longer than 6 months. Payment for both types of care will usually involve some form of insurance. Palliative care is usually covered by regular medical insurance like a doctor's visit would be. Each treatment and prescription of this care is billed separately, sometimes by different companies. Hospice care can be covered by various forms of insurance, including Medicare. It is more commonly available as a subsidized care for those who are without insurance or unable to afford it. The last area we will discuss is the issue of patient eligibility. Palliative care is made available for any patient who wants or needs comfort during any stage of their disease. It is recommended and begun at the discretion of their physician at any time during the recovery process. Hospice, however, requires that a patient have a life expectancy of about 6 months or less with ongoing deterioration. It also requires that 2 physicians certify that this is the prognosis for this patient. Remember, with hospice, the focus is on comfort and not on the prolonging life kinds of treatments or aggressive treatments that require recovery.
The nearest facility is Alive Hospice located at 1718 Patterson Street here in Nashville, Tennessee.